Hello, Assalamu alaikum. Welcome to Dr. Obity podcast. Today we have Dr. Shiza Mumtaz, and she's a wonderful physical therapist. I'd like her to introduce herself today. Welcome.
Thank you so much for welcoming me on your show. And my name is Dr. Shiza Mumtaz. I am a physical therapist here at Healthier Medical Center. And I basically specialize in treating geriatric patients and elderly individuals. That is my main focus right now.
Excellent. And I'd like to ask you, what is the most common thing you're treating?
The most common thing that I'm treating, actually surprisingly, is scoliosis. Like I've been seeing scoliosis.
What is scoliosis? Because people might ask. Yeah.
Scoliosis is actually spine आपकी का एक position होती है जो कि बिल्कुल एक मिड लाइन में रहनी चाहिए. जब उसका मिड लाइन से साइड लाइन पे शिफ्ट होता
Like
है,
a curve.
या
curvature.
कर्वेचर में जब चेंज होता है, lateral shift जिसको कहते हैं, वो जब आता है तो आपकी स्पाइन की जो है ना डिस्टर्बेंस आती है, उसके साथ आपके मस्कुलेचर पे बहुत इफेक्ट आता है. और अगर एक्सट्रीम केसेस में आपकी जो है लंग का फंक्शन के ऊपर भी जो है चेंज आता है.
And how does one, like, how do you diagnose it? Like, what is the first presenting thing to tell you? Okay, and then you're like, this is scoliosis.
The first presenting thing I would like to say is कि scapular winging होती है.
अच्छा, वो क्या होता
Scapula जो है ना, एक स्कैपुला ज़्यादा बाहर को निकला महसूस हो रहा होता है. अगर आप किसी को वॉक करते हुए देखें और देखें कि उसका एक पीछे से जैसे कमर की दो हड्डियां होती हैं,
जी, बैक पे
जिनको हम स्कैपुला कहते हैं,
राइट,
और उसमें से एक बाहर को अगर नजर आ रही हो तो देयर इज अ चांस कि एक साइड पे वीकनेस है.
So if anybody ever notices that, please remember, okay, you should come in and have a little, consultation with the doctor, and she can advise you what to do next. अच्छा, ये हो गया. Let's say somebody sees that. You will create a plan for them. How can it be corrected? Is there something which you can do to minimize it or improve it?
Of course. अगर तो postural आपका scoliosis है. Again, scoliosis की दो types होती हैं. एक तो postural scoliosis होता है जो कि आप खुद अपने बुरे posture के साथ develop करते हैं. एक होता है कि structural scoliosis या genetic scoliosis है.
By birth, ठीक है.
जो कि आपको उस तरह नहीं treat हो सकता लेकिन then there is a little bit of effort जो हम put करके worsen होने से बचा सकते हैं. लेकिन जो postural scoliosis है वो कि we see a lot of that in people who are working on their desk, especially doctors like you.
Yeah.
So you should
I'm being very
focus on your
conscious today
posture.
since doctor is here, so I'm trying to keep as straight as possible.
So this is something we see very
And I've seen it. I think it's happening. I think हम सब देख रहे हैं. We're looking at, I mean, because of kids are on their, their things, their iPads and whatever, and they are also, they look like it just you feel it. Okay, this is not good. There's something in the future is going to happen, and so I try to like subconsciously tell my kids that please keep your neck straight and all that. So what type of advice can you give to parents and to them, parents themselves? Okay, what should they look for? What should they be conscious of to keep their posture in check?
To keep your posture in check, the most important thing is कि जिस चीज़ में आपने बहुत ज़्यादा एक static posture एक रखना है. For example, if you're going to be studying, if you're going to be sitting on your desk, तो आपका properly angle होना चाहिए.
Right.
उसको आपके सामने बिल्कुल इस तरह होना चाहिए कि आप comfortable हो, ना आपकी गर्दन दुखे.
Strain na pada
Yes,
on the
exactly.
neck.
No
Yeah.
neck strain.
I think that's what's happening. A lot of people are getting a lot of neck strains because of that as well. So it's all related, isn't it? Your whole spine gets affected by it.
It's all about physics. अगर physics disturbed है, तो फिर there is some sort of bad thing that is going to happen.
Great. So what could you share a success story, like just an example, because somebody came in, you helped them with your expertise, and how what difference did it make in their life, and what did you do? Yeah.
There are actually quite a
One
few
something which
successes.
is you remember it, and it brings a smile to your face.
What brings a smile to my face is probably I had a patient of like coccydynia. And coccydynia is super like difficult to treat, and it's a very painful condition
Of the spine.
Yes, it's of the spine. तो ये आपकी tailbone में होता है.
Yeah, okay.
Tailbone ये होता है कि आप just like when you sit तो आपके buttocks के दरमियान में आपको दर्द होती है.
So it must be is an extremely excruciating pain. And you helped the patient?
I was able to help the patient.
Amazing.
And फिर उन्होंने खुद उम्रा किया.
Oh wow.
और माशाल्लाह हज किया and he walked by himself and
चलो
that
आपको बड़ी
was
दुआएं मिली होंगी.
तो बहुत दुआएं
And there's
मिली.
nothing like that, I guess. Yeah, when you see
Exactly.
success in your patient,
Yes.
you just feel that, you know, it's amazing. It's a great
Yes,
feeling, and there's
yes,
nothing
absolutely.
can beat that feeling.
Yes.
Great. So any final tips you'd like to give our viewers today, which will, you know, they can take like a take home message that they will remember, okay, you know, doctor said this, we can't forget that. What main tip would you give? Number one.
What you need to focus on, like your physics. जो आपकी body के dynamics है ना, वो proper होने चाहिए. You need to sit up straight and tall.
Yeah.
You look good and you'll feel good, and that will actually be good for you. So
I think it makes you confident as well.
Yes,
when you sit up straight,
exactly.
when you walk straight. So these things are not only physically but mentally as well. They have a big impact.
Yes,
so,
exactly. Yes.
So yeah, just be wary, be mindful of your
Yes.
positions while reading, doing work on your computer and everything. Thank you so much for coming in today.
Thank you
and
so
what you're
much
doing
for
is
having
wonderful, and I
Thank
wish you
you.
all the very best.
Thank you so much.
Thank you very much for joining us today. Allah Hafiz.